This session today is all about plugging the gap between what we know and what the real knowledge is all about. So with this thought, it's a pleasure to invite Dr. Sujeet Jha on stage. Dr. Sujeet, please come.
I must tell you, I'm a small patient, so I just came quickly what I think about. I was in the round with my boss when I became endocrinologist because of him. His name is called Stephen Beer. And I was around 2 or 3 patients. I said, Stephen, you have 3 patients. I said, can I go there and see that? I said, Steve, can you tell me about this patient? I said that. And he said, sit down. How does the patient look? I said, looks fine. Have a coffee. So we as a doctor, I'm talking about 96, 95. So most important thing, and it's important looking at the patient. Rajat, who's been CEO of Maxwell Care for 5 years, worked together. He decided to move on and just left a few weeks ago. And I can tell you, I see probably Rajat can, I'm so in front of the ex-CEO, I see the largest number for PD. I admit in 12 years, I think I'm looking at data, I've admitted 50 patients. And I can count my data, I can talk in front of it. So all the same time, worked in Max Healthcare, so didn't admitted patients. Rajat never called me, so look, why not admit patients? Because you can feel the patient, and feel the patient, and don't admit. And you say, chalega, kal aayega, parso dekhenge. So what I'm saying that thanks that I've been learned, I'm a son of a doctor, physician. So he's told me as well, look at the look and feel of the patient, which is important. Couple of things, conflict of interest. I'm a hardcore endocrinologist, hardcore medical secret prescribed medications. I may have prescribed the largest number of metformin in the world, may have been the largest number of insulin in the world. But if you look at my CV, the down below, I don't feel very comfortable what exactly I'm doing. Would I be able to treat this 9, 10, 15 crore population who has got diabetes? Am I that smart enough to do that? It's too much. Nobody cares. So, that's it.
Yeah, put the lights on so that
that's okay.
So presentation can be seen.
So will I treat into diabetes and say, look, I can solve the diabetes completely sitting in my Max Healthcare OPD? The question is no. Am I frustrated? I keep telling my patient, am I frustrated to prescribe medication to a 31 years young guy whose father just had a kidney transplant in our hospital day before yesterday? I was telling Rajat. The answer is no. Am I happy about it? I said, मैं और कुछ जिंदा कर लूँगा, बुद्धि बहुत है. I would do something else, but I feel frustrated. So the question is, the epidemic, as Tony highlighted, is gone beyond us. Even the Pakistan starts attacking with the old Megam and whatever they have, they won't be able to kill us so much that we are already dying here with diabetes. As again Tony highlighted, diabetes is a slow disease. I may be sitting here talking about with blood sugar 500 and work for like 5,000 days and ultimately reach Dr. Kuller with my kidney transplant. So it's a very important stand. The other conflict of interest about that, look, there's a null hypothesis we believe in. Any medication works is based on null hypothesis. That's the basis of it. No, we get it wrong, the industry gets it wrong. So if medications has to be proven beyond a point it's effective. The third thing, the fireman को भी डर लगता है fire से खेलने में. He would not like Max Kuduan के सामने में. So the fire guy. I said, why don't you ask him? Do you love fire? I said, no. Do I love medications? No. But do I know how to prescribe it? Yes, because I know how to deal with that fire. That's what takes 10, 15 years to understand the close interaction. It's not easy. I can't make my 18-year son, I wish, to make him a doctor on a Google. Can't. So the Google will become one of the issues. So a lot of issues. And at the same time, understand this country, the patients are very frustrated. But I can tell you, if you believe that some of the doctors are nice, some of the doctors are honest, some of the doctors are ethical, like this population, members of the doctors are a reflection of the society. What you are, what your son is, I'm one of them. I may be corrupt, I may be wrong, I may be ethical, not ethical, but they're a reflection of society. मैं कहीं बाहर से पैदा होकर नहीं आया हूँ. मैं इसी society से belong करता हूँ. So these are my conflict of interest with passion. And I worked with Max Healthcare for 12 years time. Tony being board member for almost a decade or so. And I'll tell him what I told him when he first met a little later, not like online. So these are discussion points which I have to finish in 20 minutes time. And my life is full in. I do practice diabetes, but I'm out of Max Healthcare in the sense of population study, and most of my experience would talk with a lot of people working in UK and London. I wanted to confuse you guys. I said diabetes is simple. This is the complexity of the type 2 diabetes. I'm not going to teach you, not medical students, but these are the types, subtypes, and different drugs which can cause diabetes. I don't want to make that diabetes simple. Insulin will come, weight ज़्यादा diabetes होगी. Yes, type 2, majority of sitting have type 2. Yes, 95-98%. But it's a complex disease process. Do Sujeet Jha know? No, I don't know enough about diabetes. I wish I know, and some of the professors even don't know about it. So yes, to simplify, Ritika can say, look, how can we prevent diabetes? But it's more complex than what you and me think. Just clarify that. It's much more complex. You have to think very much. You know, type 1 diabetes, you know, the Americans and the Italians have done so much of insulin. They are on insulin. Nobody is able to get cracked it. HIV, we have cracked it. Malaria, we have cracked it. So what I'm saying, the diabetes not been cracked, the type 1, the unfortunate kids on insulin. Just imagine my 5-year-old son getting diabetes on insulin all the life. Do we have solution? No. And a large number of, I met a lot of professors, and if I meet me who's Buddha in your life, who's a Jain in your life, who's Guru Gobind Singh in my life, I can tell you that 5-6 professors I met in my life are the professors, so dedicated to work with them. And sometimes, I'll be sorry to say that, sometimes the outside community, non-doctors community, don't understand that how passionate people are in the system trying to resolve the diabetes until you know them closely. So I have this opportunity to work, some of them, one of them is Prof. Kuna, Prof. Chambers, they're like Buddha, they get tapped into diabetes. So diabetes is a complex disease. I just want to highlight the yellow line. The light is, which one? So I just want to tell you one thing, that if I have no diabetes, this is blood sugar, so that's I have no diabetes. My plasma glucose is normal. So when I diabetes goes above 125 and 200, but before that, look at the relative insulin deficiency. I need to drop my insulin secretion to 50%. So I walk into Anup Mishraji's clinic and say, I've got diabetes, please reverse me. I walk into Ritika, I said, you're already there. Now if I'm here, 20 years down the line, 10 years, I can reverse it. But mind it, I walk into any endocrinologist, any physicians, even dietitians, say, look, please reverse it. I've lost 50% pancreas. Insulin resistance is insulin inability to work. Hello, Sandeep. So, clinician colleague Sandeep is here. Hello, welcome. So, this is what it is. So, this is the 50% of the pancreas gone, then you develop diabetes. The insulin resistance away, you don't need to do insulin levels. You just stand on the weighing machine and you can, you know, if you have overweight, excuse me the word, if you're fat, you have insulin resistance. Every individual in the universe who's fat will have some degree of insulin resistance. Some may have more genetically prone. So diabetes is by the time you walk in. Now these are the 4 myths. It took us a lot of time. I know Tony restricted me to do it, but I just want 4 myths into the one slide. Myth number 1, that we have wrongly, cholesterol is bad. Cholesterol is bad, is being poised to take off. Absolutely wrong. It's poised. I told you the guidelines. Okay? It's absolutely wrong. These guidelines have taken cholesterol into consideration. Not a single line has changed. Very clear. Number 2, why we are still in the middle of the statin wars. There's huge negative thing about it. If you want to put more statins, more bypass surgery in the world, don't take statins. Yes, statins lobby, maybe me lobbying the statins, but you want more statins. I'll come back and clarify that as well. Why cutoff being changed? I'll come back to that answer. This is pushing diabetes to take insulin in a middle scam, Fiona Godley, Economic Times, I'm sorry again being a little racist here, a white, tall English lady on a front line Economic Times using that statement. I wrote an email, there's an email written from Max Healthcare, and she reverted back within 2 minutes, sorry, I was taken out of context. You can see I sent the emails as well. So there's an email for him. These are the 4 myths going around every day on my WhatsApp telling us these are all absolutely wrong. Now statins we can discuss later, but why diabetes wrong? So I'll come back to that. I tell you, I'm such a smart guy, I reversed diabetes, got into Times of India headlines, gave me good commercial publicity. Do I claim it on day-to-day basis? No, because this patient who the driver of my patients in Gurgaon came to me with the blood sugar 460, give her insulin, 10 days time diabetes reverse. I said, what the hell is going on? And he came back a year later, again reverse it. Not simply we published into Diabetes Care. The first time we defined called flatbush diabetes. Diabetes reversed by insulin. Full stop. Published. We have 40 case series in Max Healthcare. If you want details, I can talk, I'll give you the details on it. This is the publication. I can tell you, to get into this is like getting a chapter in Gita. I can tell you, it's not easy to publish it. You know, probably Ritika know, my colleague, you know, it's the Max Healthcare publication again. So this is the first time it described it. Flatbush is an area in New York, and it's a diabetes been known to us where people come with a full blast diabetes and they get resolved. So is diabetes correct? Diagnosis correct? Yes, it's correct. As Tony was highlighting, it's a subtle disease. Nobody will tell you, look, knocking the door like knee pain, that is knee pain or dental pain. So diabetes comes up if your HbA1c is 6.5%, if your blood sugar is above 126, and post-meal above 200. So that's correct. Has it been lowered? No. Has it been there for some time? Almost yet. Has it been recommended by WHO? Yes. Now, why? This is not Dr. Sujeet Jha from Max Healthcare. This is a Professor K. Srinath Reddy, an ex-AIMS professor in public medicine, PHFI chief. He said cutoff been changed, but there are reasons behind it. And I've got Dr. Musa, who's primarily an ophthalmologist, would appreciate this slide because at 6.5%, 20% of the people, HbA1c 6.5 is a cutoff diagnosis, have 20% people already getting retinopathy. Just imagine. That's why it's been lowered. So you imagine a disease process where people don't know and they already have developed the complications, that too almost 20%. That's why. Just look at the population data. Look at this. This is not 1,000 patients, this is 44,000 patients, and not one. I can do the 2 lakhs data that shows that diabetes, mainly because the retinopathy developed at an earliest in diabetes, and that's a cutoff been taken off. India prevalence, I think Tony and Rajendra highlighted. I don't need to highlight everyone. You can say, you know, it's very interesting that richer parts, say Jharkhand has been getting more diabetes than Chandigarh. Okay, you know the reasons. The hypertension in Jharkhand is high, the salt intake. So the new rich in Chandigarh is getting more diabetes compared to old established rich. And there's a data to support that. So, you know, by the time, it's a public health, like smoking cessation happened 20 years down the line. So education takes time in spite of social media, and unfortunately social media is not helping us. Now, I just want to spend this is, I must owe it to Prof. Kuna, Professor Jaspal Kuna. That's the lollipop study. Now, when you think that Indians have more diabetes, everybody knows it here. But we have 3 times more risk of diabetes for the same way. What is the biggest risk factors for diabetes? Sir, what's the time? I just
Let you know 5 minutes before.
But how much time? Yeah, sorry. So, yeah. So we have, this is Indian Asians, Indian males, and this is Western women. So for any age, we have 3 times more risk of diabetes. So look at 45 years, white females compared to a white male, 3 times more risk. BMI, age is a risk factor for diabetes, BMI is a risk factor for diabetes. Waist-hip ratio, you know waist-hip ratio, not that complicated. Every point, the Indian Asian, in the lollipop, which is West of London study, this is comparing the South Asians, which is mainly Indian, Punjabi, Sikh population, Pakistani population, comparing to the white population in UK, and saying, for the same speed on a motorway, you have 3 times more risk of an accident. For the same BMI, you have 3 times more risk of accident. And if you have diabetes, you have 3 times more risk. It has to be something else. So this Prof. Kuhner, Prof. Chambers from Imperial have been learning into the, if you know the Ealing Hospital, 90% populations are South Asians going to there. And their risk of having angioplasty done has been very high 25 years ago. That's why they pitched into to understand that why diabetes is there. And so it's very important to understand, that look at the risk. For the same speed you're driving on the motorway, you have 3 times more risk of accidents. Look, you'll say, look, genetics, everyone's sitting here, doctors sitting in a big conference, it is genetics. Wrong. One word. Wrong. Proven wrong, not proven, including Prof. from AIMS, from South Indian Studies, have proven there's no major genetic difference between Indians and Caucasians that proves the diabetes right or wrong. We can discuss it later. And I'm not also a genetist, I just tell you that this is, you can see lines, some of you statisticians say they're scattered. There's nothing focusing, saying that Indian nations have moved towards one side of genetic links which says diabetes. Where we got it wrong? Say I'm from Bihar. My great-grandmother was deprived of food and I am full of food. Maybe my grandfather, great-grandfather, there's a lot of theory about it. You can think about it. But one thing is theory, from deprived to surplus is one of the reasons. Now, what surplus? Exercise, diet, how quickly it changed. the Chandigarh Jharkhand theory. So I looked into that. It's a topic whole open. I think if I stand 10 years down the line, Tony, I may be able to answer this question. Something called epigenetics. I know it's not a huge medical doctor sitting here, but epigenetics is superficial portion of the genetics which is thought to be not inheritable. It's not would pass on to new generation. So genetics is passed on. So my mother, my father, my genes have gone in. But what I behave when I was 20 to 30 may affect my son Aryan, how I behave, because I fathered him at 30, say. So that was not known to the human mankind. So what I behave from 20 to 30 may influence his diabetes risk. It's just a theory. It's not a doctor who has a big scientist and going to get Nobel Prize for it. It's just an assumption that some epigenetics phenomena and my DNA is get influenced. The whole helical structure, आपने बचपन से ही पढ़ा होगा, that is not changing. The superficial portion of the DNA, I know it's complex side, this is not changing. But certain things which is misbehaved like a traffic light signals, which can allow DNA to behave differently. What does DNA do? If I get a cancer, lung cancer, my protein is different. Who makes a protein? DNA. So DNA sends a signal, abnormal protein, I get a cancer. So a lot of immunotherapy, a lot of things been seeing gene therapy. So if the DNA behavior change similar, diabetes is ultimately, कुछ भी disease होगी तो protein ही बीच में आएगा. Ultimately DNA generally आएगा. And that's what it is. So this is, I can proud to say that Max Healthcare published for the first time in the world that epigenetics phenomena could explain 1/3 of the 3 times risk. So we Indians have 3 times more risk. That only explains the 1-time risk of only 1/3 of the risk of diabetes called epigenetics phenomena. Something happening. Why this is happening? You have to give me $1 billion to prove that. So that's what it is. Now this is a little complex, but there are different epigenetics markers which tells us that we Indians have more risk of having diabetes. Can diabetes be prevented or reversed? I just want to tell you, this is what the West is saying. This insurance, National Health Insurance, United States, health records, hospital admission record says that. 20 years time, this is the data. Okay? So they are almost trying to sort it. Why this increased cancer? Because they are living longer. The same diabetes would have died if you have gone in 60s, would have died by 1980. But the same diabetes who diagnosed at 50 are living longer. Look at this. Huge reduction. Okay? Look at this. Improving control diabetes reduces risk of all these disease. Okay? And every HbA1c rise, this is HbA1c, rise to have more deaths as well. So less stroke. If you look at heart attack and stroke, doesn't make a difference to diabetes. Once you're diagnosed diabetes, the other factors like hypertension, cholesterol needs to be sorted out to reduce the diabetes related complications. So even if you have diabetes, the risk of heart attack, strokes, unfortunately doesn't come down. So that's why the diabetes is multi-directional. That's why diabetes is not just the blood sugar. It needs to be different risk factors. This is interesting. More than 70% cardiovascular reductions in South Asians, getting down to Southwest. This is the UK data. Cath labs are shutting down. Bypass surgeons are changing their jobs. In the United Kingdom, it's true. What's happening here? 35% rise in India. So look at the trend here, look at the trend there. Exactly opposite. You have to think why. Why in UK the cardiovascular diseases come down? Okay? You say, look, smoking incidence, the obesity rate is still plateaued. America just plateauing. UK is still going up. Diabetes incidence also going up. I work with diabetes prevention management, NHS UK, who is responsible for prevention of management. Less physical activity plus certain factors. So risk factors for cardiovascular disease is gone up, but the death has gone down. Because people are talking about it, people are getting screened, people are getting treatment, people are changing their lifestyle, but the role of medication cannot be denied. The role of statins, what can prevent putting a stent in is statins and diabetes and prevention. No doubt, the diet has a role. I completely believe in that, and this is a very complex slide. So diabetes is a complex phenomenon, and it's not matter to teach you exactly what it is. Just consider a lot of new things have come up, the beta cell mass. The beta cell mass tends to go down if you reverse diabetes. That's proven. In fact, come to Max Healthcare, we have 1 MRI, which is not a huge number. I wish there are more MRI to prove it. Question is, where do we prevent? I know. So if you have normal diabetes, this is this side. Borderline diabetes, pre-diabetes. Now I walk into Dr. Budhiraj's clinic. I said, I want to revert diabetes. I'm here, revert it. He said, look, आप 10 साल पहले क्यों नहीं आए? 5 साल पहले क्यों नहीं आए? I would have reversed it. So it's very important to pick up early here. Now, if I already get a cancer and stop smoking, my doctor will say, Dr. Rodgi will say, Sujeet, you have done a wonderful job, stop smoking, or you will get cancer. You stop smoking, your cancer will get reversed. Almost like that. I'm not saying it can't be reversed, but just come back early. I don't have diabetes, I work here. I work here, that blue line. But once you've walked into diabetes, it's difficult to reverse it. We can prevent it. I'm not saying can't be reversed. People do reverse diabetes, I'll tell you that. I strongly believe we can do it. So there are factors which is reversible, you can see that. So factors which is strong evidence in science which can be reversed. This is from Prof. Anup Mishra, Ritika's work. From that, this is a large data come up. So same thing talking about, pick up diabetes early, do hardcore low calorie diet, worked earlier, better. Very interesting. I, Dr. Sujeet, who tells you I have prescribed the largest number of metformin and statin in my life, and I'm telling you that 50% diabetes can be reversed by diet alone. So if you have whole data, this is all the diet. Believe me or not, one Indian diabetes prevention from Ramchandran study, not a large study, they have no weight reduction, but diabetes reverses 26% because the diet change. High fiber diet patient walked, no weight loss. The Ramchandran data suggests that. And so what I'm trying to say, the diabetes can be reversed is that becomes more attractive. I'm sorry to use more commercially attractive. You start looking at me, this diabetes doctor is going to reverse diabetes. I'm not saying can't be, but diabetes can be prevented. Let's talk more about it. If you have 20 crore population, 8 crore population diabetes, there are another 20 crore sitting in India with pre-diabetes. Let's focus on that. We can't do bariatric surgery to prevent diabetes. Same thing like that. We need to work hard. And I'm saying that 50%. And we strongly believe in that. We did a study. So Max Healthcare, exactly when Rajat joined, we started this study. Sandeep would know that we did a large scale screening across the country, South Asian countries. We recruited 980 centers between this age group with pre-diabetes, with a high waist size. And this is the ground study. Nothing with it. There's a Max name, but none of them has been done in the Max Healthcare. It's been an outskirt in the community. So what we did, screen people, enroll people, interventions, community health interventions, so dietitian works, and I can tell you, these are the books we designed that will show you the hard work we've done. Every visit or 22 visits, how did we do it? And it was nothing to do with Dr. Sujeet Jha. Okay, I am talking about it, but nothing to do with me. It's a dietary interventions, purely dietary interventions. And the method, so, you know, if I say, look, prevent diabetes, 3 months is a honeymoon period, 6 months honeymoon period. You'll have to come to Dr. Jha, 3 saal baad kya hua? Then I can say I can prevent diabetes. 3 months, we all know it. We all know that honeymoon period, going to Jindals and reverting your diabetes. Question is, what happens 3 years down the line? So the study, So this is what is study. You know what's the biggest problem with that study? I'm happy to share. So there are 900 patients, intervention was done, and we difficulty 750 patients, free of cost dietitian trained at Max Healthcare. Nobody came in. What was the comment on this? I asked my diabetes educator to tell me कि उन्होंने बनाने में क्या गाली दी लिखी हुई. I can't say it there. What I'm saying that we as Max Healthcare, or so-called commercial places, trying to do dietary prevention with huge intention. We call dietitian, not Dr. Sujeet calling and getting faith-based feed or Max Healthcare kind of thing. These are the dietary interventions. These are the type. How difficult it is. I can reverse Tony diabetes tomorrow. But when it comes to larger community, the public health program, malaria prevention, polio prevention, it's a public health problem. It's a difficult job. Can be done, yes. We could reverse polio or whatever we can. So it's a difficult job. I can tell you what's been told in this. We also did, reversal of diabetes, we've stopped 2-3 drugs, again in Max Healthcare, and we have reversed 8 out of 14 reversed, and some of them went back. So there is a reasonable data that we could reverse diabetes as well. So these are the reverse means known diabetes on 1 or 2 drugs, on ethics committee approval, We did everything including HOMA insulin resistance, including MRI of the pancreas, and we could reverse out of 14. And we are going to initiate this program into Max Healthcare and try to reverse and select those patients who can do it. You can't pick up 70 years old with a kidney failure and try to reverse diabetes. That's too late. So it has to be some scientific basis supervised after. What India should do to reverse diabetes? What I can do, yes, well, I can treat 10 people, I can treat 30 people. The question is the broader question about India. What India should reverse diabetes trend? So, good, I'm on time. So, this is a case, which every gestational diabetes, we treat by diet 50% and 50% go on insulin, something like that. But this patients, I was telling them, do no wrong. So this was an article, do no harm. That's a basic principle of any medicine. So this particular patient was diagnosed gestational diabetes. We did genetic testing and we then treated her with insulin. And the baby outcome was fine. This was the first study which we did, which we found something called MODI, nothing to do with the Prime Minister, the name called MODI, genetics diabetes. So what we're saying that we also think a lot of things we can do wrong. And so going back to it, so I just want to tell you that the meaning of, am I right pronouncing Tony, non-ocre? Is that right? Non-ocre is, I think, is a French word, I think, I'm not sure. No, it's a Greek word.
Not good in French.
Okay. So it's a Greek word, I think. The Greek word maybe, it means do no harm.
Yeah.
So, yeah. So that's meaning. So do no harm. That's a editorial of diabetes care. And we read that article, we started doing a study which we screened 250 people for genetics among gestational diabetes, and one of them, out of 250 hard work, 2 years time, we found one genetic cases where we decided not to treat. So that's an article came in last week in API, the firm Individual Personalized Medicine in Diabetes Expert Review with Professor Mohan and others, my colleagues from across India. So we have written that how genetics can be personalized. I think Tony talked about it. But we need a lot of resources, a lot of understanding, a lot of studies. We only contribute only 1% of it, of generic studies. What we need to do, the structured high quality data. Do we get more retinopathy? Do we get more heart disease in India? So we are in Max Healthcare conducting a large surveillance against free of cost to 30,000 population. We already done 1888 till today into the SDMC hospital. This takes around 90 minutes parts to go to it. And we have got this camera, you won't find it in Max Eye Center. This is the most advanced camera with an AI capabilities. This ECG machines linked to the AI capabilities, we are not using it. We are also linking spirometry. Look, both the pollution se diabetes hoti hai. We're trying to link into it, weight automatically, all digitally talking to each other. And it's been probably Rajat would remember some of it while he was there, and Sandeep knows about this. So what we're trying to do. So we're also working with Cambridge. We Indians don't know what prevents diabetes. Mediterranean people know. I'm not saying traditional diet would not work. I'm not saying the eye health, diabetes prevention will not work. But when you talk about the scientific evidence that what works, how many grams of fiber, how many grams of fat, which fat, the traditional things I always say, I'll come back to my last statement. So I will say that yes, we need to collect data. Who eats what, who gets heart disease. You cannot have just one-off data. You need to have 10 years longitudinal data. Pick up kids of 30 years old and say, look, what you have been eating. Follow them for 10 years time, who gets a heart disease. We also need tracking device. I think I'm not going to encroach on Ritika's slide. This is what she will talk about it, that what fat is bad, what fat is not bad. I call it, I was just talking dietary guidelines. The dietary guidelines, what was there in 1920s remains same. More fruits, more fiber, walk more, as simple as that. Nothing has changed. Don't get into too much excitement about this Oxford, BMW, Cambridge diet, Ford diet, don't go into that. It's what works is खेत से प्लेट थ्योरी, जो खाना खेतों से प्लेट में आए, high fiber. मैं बोलता हूँ हिंदी में, जो खाना ना पचे वो खाओ. I'll explain it later. It means fruits and fiber. We can't digest all of them. So this is what it is. So I'll say, look, yes, diabetes can be prevented, but at the same time, the Western world, go to later, they have reversed the prevention of heart disease. 1 minute more. So this is what I say, farm to plate, जो खाना खेतों से प्लेट में आया सब अच्छा, जो डिब्बे में आया गड़बड़ है, processed food को avoid करे, and that's what it is, which Ritika will take on to that. We have so many dietitians. Every day you open the Times of India, Hindustan Times, every day there's a new diet theory, and I'm sure Ritika, if you're following the international guidelines, it says more fiber. more fruits, more fiber, walk more, dharti pe chale, dharti ka khaye, that works. Reverse diabetes early. I cannot have a cancer and I'll stop smoking. I'll have to start early. We are not saying can't be reversed. Yes, can be reversed. Can be prevented? Yes, yes, yes. But we need to screen people. If you don't know you have diabetes, how would you even know about it? So it's a very big task, wide task, which government India has to take it. We in private healthcare taking some initiative with good intention. And we are saying, look, yes, we pick up early things, disease early, treat early. But if you've gone to a 34 years guy, going back to one of my patients, creatinine already 1.4. I don't want his, he has a renal transplant in our hospital. And he said, my father just a renal transplant, when I check kara liya, creatinine 1.4. What do? You have to treat them. So yes, it's important to understand. And I would say science is not very yes and no, unfortunately. Type 2 diabetes, treat with insulin, treat with metformin. It's a very continuum. You have to start thinking about it. The more you know, the more you get confused. And it's very important to understand that. You might see a doctor or a Sandeep Budhiraja prescribing one medication, but there's a lot of background science gone into it. What Rajendra said, looking at the face, typhoid fever, he would not look at the white kind. Look at the patient, said he's got the typhoid. So there's a lot in science. NCD disease doesn't look much on the face, but you can look at the worry. You can look at the depression. So yes, it's a broad sign. Yes, I'm saying don't go with the open, I'm not saying diabetes reverse नहीं हो सकती है, reverse हो सकती है, या सबको दुनिया में गंगा में metformin मिला दो, statin मिला दो. I'm not saying that. But you have to be very open about it. Thank you very much.